Hello, welcome to Marshall Health's Open Enrollment. I'm Priscilla Midkiff, Director of Payroll and Benefits here at Marshall Health. Normally, I'd be seeing you at our in-person informational sessions to let you know everything you need to know for open enrollment. However, due to the constraints in place due to COVID-19, our delivery method has gone virtual this year. Today, you'll be hearing our recorded session about open enrollment. If you are a full-time or part-time employee with benefits, this is for you. Whether you are working on site, working at home, or temporarily not working due to COVID-19, please watch and listen and gather your questions throughout the presentation. You'll hear about upcoming plan changes, premiums, the dates for open enrollment, and how to complete your online enrollment through Dayforce. We are keeping it short and sweet this year. After viewing this session, if you have questions concerning open enrollment, please contact our benefits team. Contact information is listed at the end of the presentation and on Marshall Health's intranet site. Together, we will work to have a successful open enrollment. And now, open enrollment for plan year 2021.
Welcome to Marshall Health's Open Enrollment 2021 informational session. I'm Priscilla Midkiff, Director of Payroll and Benefits here at Marshall Health. Today, we are going to take a look at a review of our current benefits, look at our upcoming plan year premiums and benefit structure changes, and then go into when is open enrollment and how to complete your open enrollment through Dayforce. So a review of our current benefits. It's always a good idea to know what is available and what you have as a benefits eligible employee of Marshall Health. Everything from health insurances to life insurance, disability insurance, and retirement. Some are employer paid, some are paid by the employee only, and some have a cost share between employer and employee. Upcoming plan year premiums. As you will see, there is a $5 per month increase per tier. That is per month, not per pay. And we have had 3 years with no premium increases. We've been very fortunate, and we knew that that could not be sustained long term. So this year we are having that slight change of $5 per tier. Actual claims have increased, and there is an increase in the projected claims for next year, as well as some renegotiation of reimbursement rates that necessitate the change. Dental and vision premiums are not changing. They are staying the same. Benefit structure changes. Also, due to the same factors I mentioned previously, we do have a few medical plan changes. So before we jump into those, I just want to make sure we all are on the same understanding of our network tiers. We have an enhanced, standard, and non-network tiers. You can see those at the top header of these columns. What that means is in the enhanced network, you can go to any provider, but if you see a Marshall Health provider or a Cabell Huntington Hospital billed provider or North Star Anesthesia, that will be covered under the enhanced network. If you see someone in the standard network, that is anyone who takes Highmark's Blue Cross Blue Shield of West Virginia insurance nationwide, locally, St. Mary's, Radiology, Inc., etc., the benefits will be covered at the standard rates. And then non-network is any provider that does not take Highmark Blue Cross Blue Shield at all, which is very few and far between, so we tend to concentrate mostly on the enhanced and standard networks. Items in red are going to be what is changing for this next year, and as you see on the deductible, we start off with a change there. Right now, the deductible is $250 under the enhanced network for individual, $500 family, and that's changing to $300 individual, $600 family. Standard deductible, currently $600, is changing to $750 for a family limit of $1,500. It's good to note that no coinsurance or out-of-pocket limits have changed, so the total maximum amount possible to be your responsibility has not changed. As well as there's no change with office visits, primary care, specialty, or telemedicine. And just to know, we do have telemedicine services, especially during this time. That's good to know that we can use those. The deductible is still much lower than most companies in West Virginia. Even Highmark's employees' deductible, depending upon the plan they choose, can be $1,000 more individual or more. So we still are at a very good, solid, low rate for deductible. Prescription benefit. The generic formulary and non-formulary copays are all the same. We have added a new tier for specialty medications, 35% copay up to $200 per prescription. This is where the majority of our claims costs come from, is prescription drugs. And so this carving out of specialty medications, which are more often than not administered in a doctor's office, will help us curb that increase in those claims. And it's good to know and to remember that Marshall Pharmacy will continue to waive generic $5 copays. And at this, they do offer mail order delivery, which is a really good thing to know in these days when we're trying to limit personal exposure. There are also some changes in the coinsurance for a few specific benefits. Some items have changed from being covered at 100% after deductible to 90%, but only these specific services that we're going to show you here. As you can see, the autism, as well as that next section, which are physician services within the hospital, with a skilled nursing facility, or at a surgery or second opinion. They are going from 100% to 90%. As well as inpatient services for room and board, ancillary services, nursing care, surgical services, also from going to 90% covered. Emergency ambulance, human organ transplant, and bone marrow procedures, also the same. The reason for the 90% is that it falls in line with traditional health insurance plans, or still even better than most. So this also helps us keep the premiums under control and have less impact on everyone's premiums. Delta dental benefits are not changing this year, which is good news. And as a reminder, for diagnostic and preventative services, the 20% employee responsibility is waived if those services are performed at Marshall Dentistry. And there are no changes to the Davis Vision benefit. Medical Flexible Spending Account is still offered. It's an IRS-approved plan to pay for out-of-pocket medical expenses with pre-tax dollars. What that means is you're paying for these services anyways, might as well do it with pre-tax dollars through your paycheck. So the federal maximum for this upcoming year has increased to $2,750. And just be cautioned, it is a use it or lose it benefit. That means if you do not use all of the money to reimburse yourself for the year, you lose whatever is left over. So you will need to be cautious, budget your expenses, know exactly what you will have for sure, so that you choose the right level for you. Also, documentation is still required to substantiate these expenses. So you will need to keep those EOBs, statements that actually have the diagnosis code on them. That is the best way to fulfill the documentation requirement and ensure a speedy reimbursement. All right, open enrollment dates and information. Here's how it's going to work. Open enrollment is once again going to be online in Dayforce for this upcoming year. We've had it 2 years, and the third year should be starting to be familiar to you all. One of the most common questions we get is, do I need to complete an open enrollment on Dayforce? The answer is, it depends. If you need to make any change at all, yes, you do need to go in. You will either enroll in or waive every benefit once you enter into the open enrollment online. I have medical, let's say, and vision, and I want to add dental. I go into Dayforce and do my open enrollment, and I elect medical, and I elect dental, and I elect vision. If you want to participate in the medical flexible spending account, you must enroll each year, and therefore, because you're in the enrollment, elect or waive all the other benefits as well. If you want to continue your flexible spending account as is, you still need to go in and elect it and all the other benefits too. If you want to change the amount, still have to do that. If you do not want the medical flexible spending account and you have no other changes, you do not have to go into the open enrollment and complete it. Hopefully that will help you to make that determination on whether you need to actually complete an open enrollment or not. The enrollment period is Monday, May 11th through Sunday, May 31st, a good 3 weeks to make your selections. And any changes made will be effective July 1. Dayforce instructions. How do we actually go in and do this? It is best to do this on a computer, a laptop, or an iPad. The Dayforce app on your phone does not have the capability to complete the online enrollment. It does, however, have the ability to view your current elections. It's a great place to go into your app, go into your benefits under your salary or hourly role, and you will see all the benefits that you have. So you'll know what you have now, so you can make a good choice for what you would like to do next year. Then you'll go onto your computer, your laptop, your iPad, go to the benefits, overview, and start the open enrollment. You will make your selections for medical, dental, and vision and medical flexible spending account, because we know that once you are in making any choice, you have to make the choice for all. And then submit your enrollment. Please note that if you are adding a dependent to any of your coverages, you are required to submit documentation. And there will be step-by-step instructions on the Marshall Health intranet site once open enrollment begins. It will show you exactly what it should look like and how to make each and every choice. Please note that if you go back in to check the status of your enrollment, it will say pending until late June. That's because of a back-end process that we have. We don't finalize and approve the enrollments till late June. It has to do with our carrier feeds. In the meantime, our benefits team is actively looking at each enrollment, making sure everything is good to go and that we have all the documentation necessary. Questions. If you still have questions on any of this presentation or how to complete your open enrollment, please feel free to reach out to our benefits team. Our information is listed there. If you email Missy or Amber about benefits, please put in the subject line open enrollment questions. That will ensure that we get right to you as soon as we possibly can and give you the help and attention that you need. Always feel free to reach out to us, give us a call, and ask any question that you have. Thank you, and have a happy and successful open enrollment.